Zinc deficiency, symptoms and causes.
No mineral has such a strong influence on the immune system, skin, and hair as zinc. However, up to 50% of the world's population does not consume enough of it. Learn how to recognize a deficiency and what you can do about it. What do reproduction, wound healing, muscle growth, and hair growth have in common? They all need the mineral zinc to run smoothly. Without zinc, hours of exercise in the gym would be for nothing, sperm production would be on the back burner, and you wouldn't grow any hair. But luckily, zinc is in every cell of the body, even if some people don't have enough. Read this article to find out why people get too little zinc, how to recognize a deficiency, and how you can counteract it with nutrition and dietary supplements. What is zinc? Zinc is indispensable for your health. It takes over tasks in every cell of your body. Since your body cannot produce the essential trace element itself, you have to take it in daily through food. The body contains a total of 2 to 3 grams of zinc. The muscles contain the largest amount, 1.5 milligrams. What effect does zinc have in the body? As a so-called coenzyme, auxiliary molecule, zinc performs numerous tasks in the body. Zinc makes hair grow and wounds heal. After meals, it helps the pancreas to produce insulin, which lowers blood sugar. In addition, zinc stimulates the formation of testosterone and activates certain proteins for muscle building. If body cells are damaged, zinc supports cell division for new cells. Zinc helps build up our immune system and is therefore especially important in the first years of life. Together with the mineral selenium, zinc binds heavy metals such as lead that accumulate in your body. The mineral and heavy metal form an insoluble complex in which the heavy metals lose their toxic effect. In this way, minerals protect your body, especially the nerve cells, from damage caused by the heavy metals. Zinc and sensory perception. A zinc deficiency can weaken the sense of smell. Therefore, some researchers suspect that zinc plays a role in smelling. Our vision also relies heavily on zinc. The trace element helps transport vitamin A from the liver to the retina of the eye. Without vitamin A, our eyes could not perceive light. In other words, we could not see. What is the daily requirement of zinc? According to the recommendations of the German Nutrition Society, men should take in 10 milligrams of zinc daily, whereas women should only take in 7 milligrams. During pregnancy, the daily requirement rises to 10 milligrams because, on the one hand, the woman supplies the unborn child with zinc and, on the other hand, she loses high amounts through the strong urge to urinate. Breastfeeding mothers have an increased need of 11 milligrams as they pass zinc on to their child through breast milk. The U.S. National Institutes of Health recommends a similar, only minimally higher zinc intake of 8 milligrams daily for adult women and 11 milligrams for men and pregnant women. What foods contain zinc? Both animal and plant foods serve as zinc sources. However, animal products contain significantly more zinc on average. At the same time, your body can absorb the zinc from animal foods better than that from plant foods. Your small intestine cannot absorb 100% of zinc from food. It absorbs 40% from meat, milk, and cheese, while the rate for vegetables and the like is 20%. Causes of zinc deficiency. A zinc deficiency can be associated with various health problems and risks. Children in particular need to be adequately supplied with the mineral. Deficiency leads to diarrhea and pneumonia, the leading causes of death in children under 5 worldwide. Climate change could have a negative impact on our zinc supply due to high carbon dioxide emissions. The zinc content of the diet is said to have plummeted. Plant and animal foods that we import from Southeast Asia or South Africa also contain lower amounts of zinc because the soils there are low in zinc. What are the causes of zinc deficiency? If you sweat a lot, be it during sports or in good weather, you lose a lot of zinc through sweat. You should compensate for these losses with a balanced diet. A vegetarian or vegan diet can also lead to a deficiency, as the small intestine absorbs zinc from plant foods less easily. If you suffer from a chronic inflammatory bowel disease, ulcerative colitis, Crohn's disease, the absorption of nutrients in the intestine is disturbed. Permanent stress can also cause a zinc deficiency. Anti-nutrients in plant foods. Although cereals, nuts, and legumes also contain zinc, they also contain so-called anti-nutrients. They prevent the intestine from optimally absorbing zinc. This group of substances includes phytate in whole grain cereals, exception, sourdough bread. Phosphate in cola, meat, fish. Histidine in dairy products. Oxalate in spinach, rhubarb, beetroot. Tannins in wine, black and green tea. Phytate forms insoluble complexes with zinc, so that zinc cannot work in the body. To reduce the content of phytate, you can soak the grain for several hours before preparation. Symptoms of zinc deficiency. Zinc works everywhere in the body, so when there is a deficiency, symptoms appear in all sorts of areas. This often makes it difficult to classify the symptoms correctly, as they can also occur with many other health problems. Typical symptoms: if the body lacks zinc, hair can fall out and nails can become brittle. Other symptoms are slowed wound healing, tiredness, depressive moods, increased susceptibility to infections, diarrhea, loss of appetite and weight, muscle cramps, weakened sense of smell and taste, erectile dysfunction. What can be done about zinc deficiency? The optimal supply of zinc is a question of the right diet. You can control this specifically if you know which foods contain zinc and from which sources your body can absorb it particularly well. Things get more complicated when it comes to taking dietary supplements. There are big differences in quality and thus in how well the body absorbs the supplements. First of all, you should find out how your zinc supply is. Doctors can help you here, or also a mineral test with which you can have minerals such as zinc analyzed in the blood or, for some tests, also in the hair. Animal protein supports the absorption of zinc. Together they form a complex that the body can utilize very well. Other nutrients that promote zinc absorption are histidine in almonds, peanuts, beef, pork. Methionine in curd cheese, almonds, cod, mackerel, tuna fish. Cysteine in almonds, peanuts, beef, pork. Citric acid in apples, pears, berries, citrus fruits. Zinc supplements. If you have a proven zinc deficiency, zinc supplements can help you. You can find zinc supplements in every conceivable form: effervescent tablets, powder, capsules, lozenges, drops or ointments. What makes a good zinc preparation is not the form of the preparation, but the zinc compound it contains. Zinc is only ever available in combination with other substances that are intended to improve zinc absorption. Which zinc compound is the best? Several studies suggest that the following zinc compounds have optimal bioavailability. Zinc histidine, the only compound with no known side effects. Zinc picolinate. Zinc bisglycinate. Zinc gluconate. Zinc sulfate, only effective when taken on an empty stomach. Interactions. Minerals compete with each other and can prevent each other from entering the bloodstream through the small intestine. Zinc preparations can thus interfere with the effect of antibiotics, rheumatism drugs such as penicillamines, and diuretics such as thiazide diuretics. It is therefore advisable to use zinc supplements a few hours before or after taking these medicines. Zinc and biotin. Biotin is often added to zinc supplements. This vitamin is also involved in hair growth, and a biotin deficiency can lead to hair loss. Zinc also increases the activity of biotin, which makes it sensible to take it together. You take in biotin through your diet in the form of whole grain products, mushrooms and meat. Zinc in skin diseases. Nowadays, zinc is increasingly used in dermatology, skin medicine. Dermatological studies have shown that zinc helps in the treatment of skin diseases, for example warts, acne, rosacea, and basal cell carcinoma. Zinc is used externally, topically, i.e. in the form of ointments and creams, or orally, i.e. for example as tablets. The cosmetics industry also uses zinc. Sun creams and anti-dandruff shampoos contain zinc as additional light protection and to suppress the formation of dandruff. The mineral also reduces oil production in the skin. Oily skin forms the ideal breeding ground for bacteria, which can lead to infections, especially if the immune system is weakened by a zinc deficiency. Zinc excess. It is not only a zinc deficiency that poses a risk to your health. Too much zinc can also harm you. A safe upper limit is 25 milligrams of zinc per day. If you exceed this limit for several days, the first symptoms can occur. Usually, this happens because of too many food supplements. It is unlikely to take in too much zinc through the diet. If an amount between 225 and 450 milligrams is taken at once, it can lead to severe vomiting. The possible consequences of excess zinc are gastrointestinal complaints, kidney dysfunction, diarrhea, hair loss, and iron deficiency anemia. Too much zinc hinders the absorption of iron, whereupon blood formation no longer takes place properly. This leads to anemia. Excess zinc also causes the trace element copper to lose its effect. As a result of this copper deficiency, numbness and weakness occur in the limbs. The same is true for calcium and magnesium, with which zinc competes in the body. Calcium and magnesium deficiencies can lead to bone loss, faulty transmission of impulses, and enormous weakness in performance. Excess zinc can lead to a reduction in HDL cholesterol. It is considered the healthy cholesterol. HDL cholesterol repairs damage to our cell membranes and removes the harmful LDL cholesterol that causes hardening of the arteries. Zinc supplements and colds. Numerous companies advertise zinc as a miracle cure for the common cold. According to the advertising promises, it reduces annoying complaints such as the dripping nose, scratchy throat, and constant sneezing. One thing is clear: the immune system cannot function without zinc. Hence the assumption that the mineral can chase away the common cold. A study by the Cochrane Collaboration from 2012 was able to observe that 75 milligrams of zinc per day shortened the duration of a cold by 1 day. However, this only happened if the study participants took the preparation within 24 hours after the onset of the first cold symptoms. Thanks for watching, and maybe you overthink your zinc household.